بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. محاضرتنا اليوم هي المحاضرة الثالثة عشر، وسوف تكون بعنوان The Hand. So our objectives will be to list hand layers, to list facial palmar spaces, to study intrinsic muscles in relation to the layers of the hand, to follow course and branches of muscles and nerves in the hand, and to study some clinical conditions in relation to the anatomical fact, and finally to study sectional anatomy at the level of the palm of the hand. The skin on the palm of the hand is thick and hairless, and it contains large number of sweaty glands, and it is devoid of sebaceous gland. The skin on the palmar surface of the hand is firmly attached to the fascia by means of the presence of numerous fibrous bands, and the skin characterized by having many flexure creases at the site of skin movement. The skin of the palm of the hand receives the insertion of palmaris brevis muscle, which is a short muscle, arises from the flexor retinaculum and descends downward to be inserted into the palmar aponeurosis of the hand. This muscle serves as a corrugator for skin or at the base of the hypothenar eminence to improve the sensory innervation of the skin of the palm of the hand is derived from the palmar cutaneous branch of median nerve, which supplies the skin over the lateral two-thirds of the palm of the hand. The medial one-third is supplied by the palmar cutaneous branch of ulnar nerve, and the skin at the base of the hypothenar eminence is supplied by the lateral cutaneous branch of forearm or the superficial branch of radial nerve. Palmar aponeurosis is a thickening of the fascia of the palm. It is triangular in shape and occupies the central area of the palm. The apex of the triangle being attached to the distal border of flexor retinaculum, and the apex receives the tendon of palmaris longus if present. Now, the base of the triangle is divided at the root of the fingers into 4 slips, and each of these slips divides into 2 bands. One runs superficially to reach the skin to be attached there, and the other one passes deep to the root of the fingers. Each deep band divides into 2 slips, which diverge around the long flexor tendons of the fingers, and finally fuses with the fibrous flexor sheath of the fingers and the deep transverse ligament. Now, the medial and lateral borders of the aponeurosis are continuous with the fascia, deep fascia that covers the thenar and hypothenar muscles. The medial and lateral border of the aponeurosis send fibrous septa which run posteriorly into the palm and take part in the formation of the palmar facial spaces. Carpal tunnel is an osteofacial tunnel present on the anterior surface of the wrist. من اسمه هو osteofacial, so it is formed by bone and fascia, posteriorly the carpal bone and anteriorly the flexor retinaculum, and it is formed by the concavity on the anterior surface of the carpal bones, which is bridged by the flexor retinaculum. Fibrous flexor sheaths. These are strong sheaths extending on the anterior surfaces of the fingers, from the head of metacarpal bone to the base of the distal phalanges. The fibrous flexor sheath is attached to the sides of the phalanges. The proximal end of the sheath is patent, while the distal end being closed and attached to the base of the distal phalanges. Together, the fibrous flexor sheath with the phalanges form a blind tunnel for the passage of the long flexor tendons of the fingers. Synovial flexor sheaths. These envelop the long flexor tendons of the fingers of the hand, and the sheath that envelopes the tendon of flexor pulsus longus is referred to as radial bursa, while the sheath that envelopes the tendon of flexor digitorum superficialis and the profundus is referred to as ulnar bursa. يعني احنا راح يكون عندنا fibrous flexor sheath extending along the whole length of the proximal and middle phalanges attached to the base of the distal phalanges and forming a blind tunnel through which the long flexor tendon pass to be inserted into the base of the distal phalanges. لكن هذا التندن لما راح تفوت بهذا الفايبرس flexor sheath أو بهذا التنل اللي هو formed by the fibrous flexor sheath and the bones of the phalanges يراد لها فد lubrication، فراح هذه التندنز surrounded by the synovial sheath اللي نسميه synovial flexor sheath، وهذا synovial flexor sheath secrete fluid into the synovial sheath على مود يسوي لنا lubrication during the movement of the long flexor tendons within the tunnel. Both of ulnar and radial bursae started finger breadth proximal to the flexor retinaculum, and just above the flexor retinaculum, the proximal border of flexor retinaculum, about finger breadth. Radial bursa descends downward to be inserted into the base of the distal phalanx of the thumb without interruption. The medial part of ulnar bursa descends downward without interruption on the tendons of little finger until it reaches the base of the distal phalanx of the little finger, while the remainder of the synovial sheath of the ulnar bursa ends approximately at the level of the proximal transverse crease of the palm. The distal parts of the long flexor tendons of index, middle, and ring fingers have their own digital synovial sheaths, which commence at the level of the distal transverse crease of the palm and terminates at the level of the bases of the distal phalanges of the corresponding fingers. Now, the synovial sheaths allow the long flexor tendons of the fingers to move freely and smoothly with minimum friction beneath the flexor retinaculum and within the fibrous flexor sheaths of the fingers. Insertion of long flexor tendons. طلاب احنا بالمحاضرة مالت الانتيريور compartment of forearm تكلمنا عن الانسرشن of the flexor digitorum superficialis tendons، وقلنا انه التندنز of digitorum superficialis on reaching the anterior surface or the proximal phalanx of the finger divide into two slips which pass around the tendon of digitorum profundus muscle. Now these slips rejoin each other on the deep surface of the tendon of profundus to form main stem of the tendon, which further divided into two slips that descends downward to be attached to the borders of the middle phalanx. Now each tendon of profundus muscle, having passed through the sling formed by the tendon of superficialis, continues downward to be inserted into the anterior surfaces of the base of the distal phalanx of the finger. Small muscles of the hand. These include 4 lambrical muscles, 7 interossei, short muscles of the thumb, and short muscles of little finger. طلاب لازم نخلي بالنا انه الانتروسياي هي بعض الكتب تقول عليها 8، بعض الكتب تقول عليها 7 انتروسياي. اللي يقول عليهم 7 راح يعتبر ال 2 heads of adductor pollicis muscle اللي هي واحدة من المسلز short muscles of the thumb، يعتبر 2 heads هي related to adductor pollicis. So the palmar interossei هنا راح تكون 3. بعض الكتب الأخرى تعتبر الادكتر pollicis هي one head and the other head اللي هو transverse يعتبرها ضمن البالمر انتروسياي، فعليه راح تكون 4. احنا راح نعتمد البالمر انتروسياي 3، فراح يكون الانتروسياي 7 3 palmar and 4 dorsal انتروسياي. Now بهاي الصور اللي واضحة قدامنا طالعت لنا اللي بيها number 1 2 3 these are the palmar interossei and now the 1 2 3 4 these are the dorsal interossei. الصورة مالت الكدفر اللي بيها مبين هذا الشايني اللي هو الأبيض هو this is the tendon of flexor digitorum profundus and showing the muscles اللي هي lambrical muscles attached to the tendons. So the lambricals or lambrical muscles arises from the tendons of flexor digitorum profundus from the lateral margin of the tendon of flexor digitorum profundus and to be inserted into the proximal phalanges of the medial forefingers and the corresponding extensor expansion. Now the palmar interossei arises from the shaft from the anterior surfaces of the shaft of the second, fourth and fifth metacarpal bone, their tendons inserted into the proximal phalanges of the index, ring and little fingers and to the extensor expansion of these fingers. While the dorsal interossei, which are the first, second, third and fourth dorsal interossei, arises from the contagious sides of the shafts of metacarpal bone, their tendons inserted into the proximal phalanges of the medial forefingers with their extensor expansions. Short muscles of the thumb include abductor pollicis brevis, flexor pollicis brevis, apponens pollicis, and adductor pollicis. The first 3 muscles of these form the thinner eminence, and all the 3 muscles that form the thinner eminence take their origin from the flexor retinaculum. The abductor pollicis brevis and flexor pollicis brevis get inserted into the base of the proximal phalanx of the thumb, while the apponens pollicis is inserted into the shaft of the first metacarpal bone. بالحقيقة the medial border of the shaft of the first metacarpal bone. The adductor pollicis arises by 2 heads, an oblique head from the bases, from anterior surfaces of the bases of the second and third metacarpal bones, while the transverse head arises from the anterior surface of the shaft of the third metacarpal bone. the two heads join each other and runs laterally to be inserted into the medial aspect of the proximal phalanx of the thumb. Short muscles of little finger. These include abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi, which together form the hypothenar eminence. The adductor digiti minimi arises from pisiform bone, while the flexor digiti minimi and opponens digiti minimi arises from the flexor retinaculum. Abductor digiti minimi and flexor digiti minimi inserted into the base of the proximal phalanx of little finger, while the opponens digiti minimi inserted into the medial border of the shaft of the fifth metacarpal bone. Arteries of the palm. Ulnar artery. It enters the hand by crossing in front of the flexor retinaculum on the lateral side of ulnar nerve and pisiform bone. واحنا تكلمنا بالمحاضرات قلنا الارانجمنت راح يكون pisiform bone from medial to lateral, pisiform bone, ulnar nerve, ulnar artery. Ulnar artery gives off the deep branch and then it continues into palm as the superficial palmar arch. The superficial arch is the direct continuation of the ulnar artery, and on entering the palm it curves laterally behind the palmar aponeurosis in front of long flexor tendons of the fingers. يعني احنا على مود نشوف السوبرفيشال palmar arch راح نشيل السكن ونشيل الديب fascia of the palm, which is represented by the palmar aponeurosis. فلما راح نشيل البالمر aponeurosis راح يكون عندنا exposure لل superficial palmar arch and the long tendons of long flexor tendons of the fingers. The superficial palmar arch is completed on the lateral side by one of the branches of the radial artery. The curve of the arch is situated across the palm of the hand at the level with the distal border of a fully extended thumb. يعني احنا نسوي full extension للثumb مالتنا راح الكيرف from the tip of the fully extended thumb to the palm of the hand هو راح يكون the level of the superficial palmar arch. From the convexity of the arch, four digital arteries arise to reach to the corresponding fingers. The deep branch of ulnar artery arises in front of flexor retinaculum and it passes deep between the abductor digiti minimi and flexor digiti minimi. And finally, it joins the radial artery to complete the deep palmar arch. هنا لو نجي على الهايبوثينر muscles هي راح تكون from يعني the most medial one هي الابدكتور digiti minimi إذا تريدون تقولون عليها الأوتر, then flexor digiti minimi, then the opponens digiti minimi which lies against the shaft of the fifth metacarpal bone. So the deeper branch of ulnar artery travels between the abductor digiti minimi and flexor digiti minimi to reach the palm of the hand. Radial artery. احنا تذكرون بالمحاضرة مالت الدورزم of the hand او ال posterior compartment of the forearm قلنا ال radial artery crosses in the snap box and then it reaches the dorsum of the hand. Now radial artery leaves the dorsum of the hand between the two heads of the dorsal interosseous muscle, between the two metacarpal bones, the first and second metacarpal bone. On entering the palm, it runs medially between the oblique and transverse head of the adductor pollicis muscle. Then it continues beneath the long flexed tendons of the finger as the deep palmar arch, which is completed on the medial side by the deeper branch of ulnar artery. The deep palmar arch situated at a level with the proximal border of extended thumb. The deep arch sends many branches superiorly, which take part in the arterial anastomosis around the wrist joint, and inferiorly to join the digital branches that arise from the superficial palmar arch. Branch of radial artery in the palm, radialis indicis artery, which supplies the lateral side of index finger, and the princeps pollicis artery, which divides into two branches to supply the lateral and medial side of the thumb. Veins of the palm of the hand. The superficial and deep palmar arches are accompanied by superficial and deep palmar venous arches, which receive corresponding tributaries. يعني ال superficial palmar arch انطى digital branches to the fingers، راح يرجعون digital veins to the deep and superficial palmar venous arches, and so on. Lymph drainage of the palm. Lymph from medial side of the palm, it drains into lymphatics that ascends in company with the basilic vein to drain into supratrochlear group of lymph nodes, which ultimately drain into lateral axillary group of lymph nodes. Lymph from the lateral side of the hand drains into infraclavicular group of lymph nodes through lymphatics that travel in company with cephalic vein, and some of them drain into lateral axillary group of lymph nodes. Nerves of the palm of the hand. Median nerve. As the median nerve crosses behind the flexor retinaculum to enter the palm of the hand, it divides into medial and lateral branches. The muscular branch of the median nerve takes a recurrent course at the lower border of flexor retinaculum to reach and supply the thinner muscles of the thumb. In addition, it gives a muscular branch to the first lumbrical muscle, while the cutaneous branch of median nerve supply the palmar aspect of the lateral 3.5 fingers and the distal half of the dorsal aspects of each finger. على اعتبار احنا the proximal half of the dorsal aspect of the fingers supplied by the superficial branch of radial nerve أو ulnar nerve, dorsal branch of ulnar nerve. So, one of these branches supply the second lumbrical muscle, and the palmar cutaneous branch of the median nerve, which arises from the median nerve in the anterior compartment of the forearm and crosses anterior to the flexor retinaculum, supplies the skin over the lateral two-thirds of the palm of the hand. Ulnar nerve crosses in front of the flexor retinaculum to enter the palm of the hand, just lateral to pisiform bone, and then it is divided into superficial and deep branches. The superficial branch of the ulnar nerve descends into the palm in the subcutaneous tissue between pisiform and hook of hamate. The superficial branch of ulnar nerve gives off muscular branch to palmaris brevis. اللي قلنا هي small muscle arises from a flexor retinaculum to be inserted into the skin of the palm وسوي لنا corrugate skin at the hypothenar eminence. And cutaneous branch to palmar aspect of medial side of little finger and the adjacent sides of the little and ring fingers. It also supplies the distal halves of the dorsal aspects of each finger. يعني الأصبع ونص الميديال راح ياخذون من الالنا نيرف، والثلاث أصابع ونص اللاترال راح ياخذونه من الميديال نيرف. The deep branch of ulnar nerve passes backward deeply between the abductor digiti minimi and flexor digiti minimi, and it pierces the opponent's digiti minimi to reach the hook of hamate and turn around the lower border of the hamate hook and crosses laterally within the concavity of the deep palmar arch. Now, the deep branch of ulnar nerve situated within the concavity of the deep palmar arch, situated behind the long flexor tendons of the fingers in front of metacarpal bones. The deep branch of ulnar nerve gives off muscular branch to all muscles of hypothenar eminence, including abductor digiti minimi, flexor digiti minimi, and opponent's digiti minimi. In addition, the deep branch gives many branches to supply all palmar and dorsal interossei muscle and the third and fourth lumbricals, in addition to both heads of adductor pollicis muscle. The palmar cutaneous branch of ulnar nerve, which arises in the anterior compartment of the forearm, crosses in front of flexor retinaculum to supply the skin over the medial 1/3 of the palm of the hand. Facial palmar spaces. These are potential spaces filled with loose connective tissue. Their boundaries are important clinically as they may limit spread of infection in the palm of the hand. From the medial border of the palmar aponeurosis, a fibrous septum passes deeply backward to be attached into the anterior border of the fifth metacarpal bone. Just medial to the septum, a facial compartment containing the hypothenar muscles is found, and this compartment is unimportant clinically. From the lateral border of the palmar aponeurosis, a second fibrous septum travels deeply backward obliquely to the anterior border of the third metacarpal bone. This septum divides the palm into thinner space, which is situated lateral to the septum, and mid-palmar space, which is situated medial to the septum. Proximally, thinner and mid-palmar spaces are closed off from the forearm by walls of the carpal tunnel. Distally, the two spaces are continuous with the lumbrical canals. The thinner space contains the first lumbrical and situated behind the long flexor tendons of the index finger and in front of adductor pollicis muscle, while the mid-palmar space, which contains the second, third, and fourth lumbricals and lies behind the long flexor tendons of middle ring and little fingers, and in front of the interossei and the third, fourth, and fifth metacarpal bones. The palm space of the fingers. The D fascia of the palp of each finger fuses with the periosteum of terminal phalanges, just distal to the insertion of long flexed tendons of the fingers, and closes off a facial compartment known as palp space. Carpal tunnel syndrome. As the long flexed tendons with their surrounding synovial sheaths and median nerve are packed within the carpal tunnel, median nerve compression might result from thickening of the synovial sheaths or arthritic changes in the carpal bones, which leads to what's called the carpal tunnel syndrome. The exact cause of the compression is difficult to determine. The clinical feature of carpal tunnel is represented by burning pain along the distribution of median nerve and weakness of the thinner muscles. No paresthesia occurs over the thinner eminence because this area is innervated by the palmar-cutaneous branch of median nerve, which arises from a median nerve in the anterior compartment of the forearm and crosses in front of flexor retinaculum. The condition is dramatically relieved by decompressing the tunnel by making a longitudinal incision through the flexor retinaculum. Horizontal section at the level of the carpus, showing the thinner muscles and hypothenum muscles and the flexor retinaculum and long flexor tendons of the fingers with the median nerve packed in the carpal tunnel, trapezium and pisiform bone of the carpus. In summary, the sensory innervation of the palm derived from the palmar cutaneous branch of median nerve and ulnar nerve. The palmar aponeurosis is a thickening of the fascia of the palm. The fibrous flexor sheath is a strong sheath extending on the anterior surface of each finger. Small muscles of the hand include 4 lumbricals, 7 interossei, short muscles of thumb, and short muscles of little finger. Superficial palmar arch is a direct continuation of ulnar artery.